Good morning, all. We have gathered today for a new episode under the Hindus Wellness Webinars to commemorate the World Heart Day, which is celebrated every year on September 29. We all know and understand how important it is to maintain heart health, and through today's webinar, where we are joined by three experts from Kauvery hospitals, the objective is to raise more awareness about cardiovascular diseases and promote heart health. Heart Health Inside and Out is presented by Kauvery Hospital in association with The Hindu, and the panelists will discuss the preventive strategies, the treatment options, and the latest developments in cardiac care while addressing issues ranging from congenital heart diseases to heart attacks in young adults. So let us move on to the introduction of the doctors and their presentations. We begin with Dr. Arun Kumar Krishnaswamy. Dr. Arun Kumar Krishnaswamy, Senior Consultant in Cardiothoracic Surgery at Kauvery Hospital, Alvarpet. Dr. Arun Kumar has extensive training and expertise in complex cardiac and thoracic procedures. After completing his MBBS, MS in General Surgery, and MCH in Cardiovascular and Thoracic Surgery from Dr. MGR Medical University, Chennai, he went on to do a DNB in Cardiothoracic Surgery from the National Board of Examinations, FMAS from the Indian Medical Association, and FRCS, Cardiothoracic Surgery from the Royal College of Surgeons, Edinburgh. His areas of expertise include coronary artery bypass surgery, on-pump and off-pump, management of mechanical complications of ischemic heart disease, valve replacements and repairs, adult and congenital heart diseases, and minimally invasive cardiac surgeries. Dr. Arun Kumar has received several awards, including the MGR Ratna Award from the Government of Sri Lanka. He is a recipient of MGR Medical University Medal and Sushila Santosha Memorial Gold Medal, presented by the then Chief Minister of Tamil Nadu in 2012. His innovative work in cardiac surgery earned him the TED Award at CMC Vellore in 2013. His work chart is hugely impressive with 5,000 open heart surgeries, 4,000 cardiothoracic surgeries, 250 open heart surgeries, 3,500 off-pump coronary artery bypass grafting procedures, over 200 arterial revascularization surgeries, 770 valvular heart surgeries, 120 minimally invasive cardiac surgeries, over 100 closed heart surgeries, more than 750 cardiothoracic surgeries, and much more. A member of Association of Surgeons in India, the Indian Medical Association, the Cardiological Society of India, among others, Dr. Arun Kumar is known for his meticulous surgical skills, commitment to patient care, and contributions to advancing cardiothoracic surgery through innovation and clinical excellence. He will now speak on the recent advancements in coronary artery bypass surgery. So welcome, Dr. Arun, and it's over to you.
Thank you, Soma. Thank you for your nice introduction. So today, the World Heart Day, September 29, we are celebrating this year 2025. Don't miss a beat. This is the theme of this year. And every year we are celebrating to create the awareness, one of the major killer diseases in the globe. So everyone aware of this problem, sudden cardiac death. Patient was absolutely normal, sudden collapse. He died on the sleep, all those things. So the major killer disease currently we all know, even before the cancer, is a heart disease. So today I'm going to talk about, in this World Heart Day, I'm going to talk about coronary artery bypass grafting, the best pathway, that is the opening road to the healthier heart. So we know the many the treatment modalities there for the coronary artery disease, but the coronary artery bypass grafting still a gold standard for the particular problem. So before that, we should know something about the heart and some details about the heart and disease. The heart, from womb to tomb, do you know the heart is a very fascinating organ? The organ, the first one to function during the intrauterine life. This is the first organ in the body under the mother start working. Around 22 days of intrauterine life, it start functioning. And it is the only organ, it's a fascinating one, which functions not stop till your death. So we all know our feelings, our emotions, our entire all good feelings, bad feelings, everything we connect to heart, not brain. And because it has some direct connections with our feelings, everything, and it changes with all our emotions, including the rate and some other things, all are connected to the heart. So that's why the meaning of the heart, it comes from the soul or feeling. And it's a wonder organ. It's a stupendous function, non-stopping. It never takes rest, never goes wrong, and never miss a beat unless you are not taking care of it regularly. So the other important, the fantastic things, the heart beats 72 per minute. Everyone knows it, and it almost 38 million times per year, and 70 ml per beat, 5 liters per minute, and 7,200 liters per day. Can you believe it? No one are able to take the 7,200 liters per day. It is not possible. But one of our organ continuously, without taking rest, doing its job. That is, per day it is 7,200 liters. It is continuously functioning without without taking any rest. Even at rest, a person sprinting, the muscles of heart, that is called myocardium, works twice as hard as the leg muscles. So it is one of the most strongest and the most fascinating organ in our body, and everyone fail to remember until it cries with pain. Nobody takes care of it until someone had a problem, or someone tells you that the heart attack is very common, something about heart problems. And heart disease is the biggest killer. You see, this is statistics from government of India. You can see the Punjab, Haryana, and Tamil Nadu is the highest prevalent states. Around more than 5,000 diseases per lakh population. And if you see the cholesterol also, the most abnormal state, you can see the red is Tamil Nadu. So we are a capital even in the India. India is a capital for diabetes and capital for cardiovascular diseases. Not only that, we are living in a Tamil Nadu. Tamil Nadu is supposed to be very good in shape, but this is a shocking one. And you can see your food habit matters a lot. With the epidemic of midnight biryani, all those things, everyone is aware. Our dietary habits is the major reasons. Only after the blood pressure and the diabetes status, tobacco, everything comes. So this is one important thing every Indian should know. The Indians are 3 times higher risk for developing heart attack than a Western population. So you heard the incidence of a heart attack and sudden cardiac death related to the cardiovascular problem is 3 times higher, and most of them, 3/4, around 75 to 80% of a cardiovascular death affecting low and middle income countries. It is not affecting high affluence, it's only affecting the low and middle income. And over 17.9 million people died of cardiovascular disease in 2016 across the globe. Of this, 85% is due to the heart attack and stroke related to the cardiovascular system. In this slide, you can see with increasing age, the incidence of cardiovascular disease and the development and the cardiovascular disease related mortality increases. So we all aware the aged people used to get the cardiovascular disease, coronary artery disease. So the average age in our practice around 5 years back, 50 to 60s. But if you take the statistics recent years, 1 or 2 years before, the statistics predominantly affecting 45 to 54 years. Every day we are operating around 45, 50. This is our order of the day in our practice. And this statistics, you can see the most common cause of death across the globe. And in India, particularly, the statistics came from Register General of India. The most common cause is cardiovascular. If you see the male 20%, female 16%, and COPD, diarrhea, other things comes later. So we all very well know this fact. The cardiovascular is a major killer of in the globe. So the most common cardiovascular disorders, coronary artery disease, the artery which supplies the heart called coronary arteries, the most common problem. After that, the valvular disease, the dilatation affecting the great arteries, the heart failure due to various causes, cardiomyopathy, arrhythmia disorders, all those things. Congenital heart disease still, yeah, it is another important a burden to our country. The heart attack, the sudden killer. The blood vessel in the heart, which present over the superficial part of the heart. When you open the chest, you can see the arteries running over the heart. That is called coronary artery. 80% of cardiovascular deaths occur in the low and middle income countries, and heart attack may be the sudden killer, but the disease occurs a prolonged adoption of poor lifestyle in an early age group. It usually not starts acutely. It is accumulated, this cholesterol deposition accumulated over the years, approximately more than 15 to 20 years. Only it crosses certain percentage, sudden occlusion common. We'll discuss this. So the particular phenotype, uniqueness in a South Asian population, we have discussed already. Indians are 3 times prone to develop a heart disease compared to Western population. This is the reason, the phenotype uniqueness. In India, the premature atherosclerotic disease is common. Our arteries, the coronary arteries, are small sized compared to the Caucasians. And our problems, atherosclerosis, are severe in a younger age itself. And a greater prevalence of LV dysfunction, the heart dysfunction. And the complexity also very high compared to United Kingdom or United States. They are all having a bigger size vessels, more than 2 to 3 but our population constant vessel size is 1.75 or 1.5. In these all these phenotype problems, we are already and maintaining a poor lifestyle and poor way of living, including with some risk factors of smoking and alcohol. All putting together, increasing the risk and the patients coming at a younger age like 29, 30, 40 with severe triple vessel disease for bypass surgery. So we know all these things, we know, need not discuss. Everyone knows this. Smoking, blood pressure, higher cholesterol, physical inactivity, diabetes are important risk factors. But one should know these are the modifiable risk factors. One, we cannot modify the genetic inheritance. The parents have suffered of heart disease less than 50 years, 55 years. Those parents are inheriting the genes due to some other cholesterol abnormalities. And age we cannot change, gender we cannot change. The males are more prone to get the heart attack than the female. But one should remember this, the smoking, alcohol, and diabetes, particularly poor food habits, eating food at midnight and eating a high calorie diet midnight, all are causing the significant burden of heart disease in a younger population. One should remember this. This all are modifiable. Common symptoms, chest pain. The chest contains a lot of parts, but the angina, the pain coming from the heart, usually it is a compressive type or sometimes a stabbing with associated with the sweating and the pounding heartbeats. And sometimes there is upper abdominal pain. Sometimes the pain radiating to the left arm or shoulder, jaw, or even ear. These are all the pain which starts from the chest and radiating to this place. With the sweating, you have to give importance and take medical attention immediately. Without, you can think, I don't have a diabetes, I don't have a smoking habit, all those things, but still these are the symptoms needs urgent intervention, urgent attention. So sudden cardiac death, you heard younger cardiothoracic surgeon a few months back suddenly died of acute MI. This is sudden cardiac death predominantly from the coronary artery disease. Usually it is due to the arrhythmia of the heart. So coronary arteries 3, right side 1, left side 2. Among this, the left side has a main one artery called the left main coronary artery. All this from the birth to certain age of time, it will be normal. Due to various reasons, multifactorial reasons, the cholesterol deposition starts in the coronary arteries. This is not evident with wrist ECG, wrist echocardiogram, but it will be evident when you do as a stress investigation, like a treadmill test, stress echo, or some other nuclear scan. Everyone asks how I had this disease, I don't have any symptoms, like this common questions we encounter during our practice. So the coronary artery disease, the treatment modalities, from the medications, interventional treatment like angioplasty, and the gold standard treatment, coronary artery bypass surgery. We all know bypass road. When there is a congestion happening in the place, we have to put a bypass road to overcome this congestion. The same concept. When there is a block here, you can see the block here in the significant arteries, the important arteries. When these blocks are very significant, when particular treatment is not amenable, the bypass comes as a savior and it is a gold standard. And the CABG, that is a cabbage we call, common layman term, coronary artery bypass grafting, is the only surgery to the mankind which consistently improves the survival in many times in all the scientific evidence. So this is the one surgery in the science has got highest level of evidence, highest class of recommendation. Once we are advising a coronary artery bypass surgery of a particular disease, that is left main coronary artery disease or the triple vessel disease, all three blocks, particularly when the patient diabetes, this is the gold standard. The class 1 recommendation means that the highest evidence with the highest recommendation all over the world, all over the associations, from the American, European, Indian association, all are recommending class 1 recommendation, that is a gold standard. And coronary artery bypass surgery, what it does, what is the wonder with the coronary artery bypass surgery? It relieves the chest pain. It prevents the damage to the myocardium, the recurrent heart attack prevented. Confidently, we can say that a recurrent heart attack prevented. And of course, the heart shape maintained after the surgery. If the patient comes with early stage without any scar, doing bypass surgery reverses the LV size and the patient quality life improved, and definitely the life expectancy comparable, not comparable with any mode of treatment other than coronary artery bypass surgery. Still, it is the most commonly performed cardiovascular surgeries. More than 3 lakhs, it is registered in 2008. Currently, more than 3 lakhs isolated cases done all over the world. Now, the patient used to ask, sir, what is the significant? My block is 50%. Whether this is significant, does it need any treatment? So, in any coronary artery disease, the blockage is more than 70% requires intervention. If it is 70% in a two-dimensional, if you see in a cross-sectional, it is 90%. V equal to pi r square. So 70% we call significant lesion. The incidence of heart attack, sudden heart attack, this remaining space occluded by the clot is very common when it is crossing 70%, and it is more than 70%, it gives angina when particularly the patient doing exercises. But only one exception, when this lesion occurring 50% in the left main artery, we need to intervene with the surgery or any other modality treatment. That is the requirement, because the large part of myocardium under the risk, we need to do surgery in these circumstances. So other things, triple vessel disease, the left main coronary artery, the artery which just takes out from the aorta and just 2 to 3 centimeter, the length, this is called a left main. When there is a lesion in this left main, this is a major disaster. Anytime more than 50% develop major heart attack, and the risk of sudden cardiac death is very high in the left main disease. And the triple vessel disease or any double vessel disease with patient diabetes. Patients with the diabetes, a greater benefit with the coronary artery bypass surgery than any other modality of treatment. Patients with the lower ejection fraction, lower heart function, definitely have a greater edge in the coronary artery bypass surgery than any other treatment. Even in the acute heart attack, when the stenting is not possible, in acute heart attack, the stenting is the gold standard. That is a life savior, no doubt. But certain situations, the stenting is not possible, like a mechanical complications. Still, the CABG has a greater role in these situations. And definitely, it is proven beyond multiple times, CABG prolongs the survival in asymptomatic patients, particularly the diabetes patients, and particularly in the LV dysfunction patients. So how we are doing the coronary artery bypass surgery? So the important advantages of coronary artery bypass surgery is the vessels, the good vessels we are taking from your body and connecting to your heart. one of the God's gift in this discussion is a conduit we call is the internal mammary artery. That is left side, you can see in this picture, this is a sternum breastbone we call. There is two blood vessels coming from the subclavian artery, we call it internal mammary artery. This artery usually supplies to the breast in a female, chest wall to the male. This artery, it's a God's gift we call, or nature's highest gift. Usually, even in a patients with severe atherosclerosis, severe cholesterol abnormality, this vessel is not affected. This vessel never affected with the severe atherosclerosis. This is always preserved. So, taking advantage of this vessel, we are harvesting from the chest and connecting to the heart. And also, this vessel has got an important thing is called a nitric oxide. This will running into the heart and keeping the blood vessel, diseased blood vessel, open for a longer time. This is a one artery. This is natural artery given to the patient. They live long. The next conduits, we use saphenous vein, and this is taken from the leg. Currently, we are having as endoscopic method without opening entire legs. And other conduits, we use artery from the radial. The arteries connected to the arteries live long compared to the vein. So we prefer many times in a younger age group, we prefer arteries from the mammary artery, right and left. We prefer radial artery. When we do the bypass surgery with these arteries, the outcome and the longevity with the quality of life is very good. Particularly, we see more than 15 years, many patients, more than 95% of the patients, and we see even 20-25 years. So we predominantly 99.5% we are doing in a beating heart surgery. Only we have to open the breastbone, not like a previous 10-15 years back. We are opening just 7 to 8 inches in a conventional surgery. It is done in the beating heart surgery without stopping the heart. So we call it as off pump surgery, the greater recovery, lesser renal function, dysfunction, lesser coagulation problems, all those things. The recovery is just 3 to 4 hours ventilation. Within one day, we are shifting to the patients to the ward. This is called a total arterial revascularization. Conventionally, we use veins from the legs. Currently, we are all moving towards almost majority of the patients getting arteries. So right and left internal mammary artery from the radial arteries taken and connecting, bypassing 3, 4, 5 vessels, and we are giving excellent outcome for the long term. So longevity, even after the mammary artery, all those things, the longevity depends on only 3 factors after the surgery. Every patient should remember they have to take a blood thinners for the life, cholesterol controlling drugs called statins for the life, and diabetes control. Of course, this is another most important thing. And of course, everyone knows exercise, walking every day for at least for 45 minutes. Definitely, when you do this after bypass surgery or after any intervention, definitely this will give a gross benefit in the patients. Definitely, this have a significant advantages. And currently, we moved from the opening the chest, we moved 3 inches surgery called minimally invasive surgery. In Tamil, Sirudulai surgery. We are approaching the heart through small opening below the left side of nipple for the bypass surgery. This is commonly done in our hospital, and this is a very order of the day in our practice. Most of the surgeries we can perform through this. And other advancements, hybrid surgery, cardiologist can use the stenting for a right-sided vessel, left-sided vessel, we can give the mammary artery. Because the mammary artery always has got advantages, and when you connect the mammary artery, it is an important artery called LAD, the life expectancy is very good. So we can add up with hybrid surgery, right side stenting, left side bypass surgery. This is also has got upcoming methods. And we are doing some additional intervention at the same time when we are doing a CABG in a minimal invasive. If the patient having a carotid artery lesion, we are doing a carotid surgery for the patients who are had already strokes or the patients who are having a risk of developing strokes. So we call it a coronary endarterectomy, or sometimes the patient, the carotid artery stenting also can be done. And a very recent advance. So in a minimally invasive surgery, what we do, we have to split the
Dr. Arun
or
Kumar,
spread the
may I
ribs.
interrupt you? We have
Here,
2 more speakers also to go.
right.
So if you
Last
could
slide, madam.
rush through.
So this is a last slide. We are doing a robotic surgeries. The coronary artery bypass surgeries can be done in a robotic also in a very good manner. So we are having other features of genetic modulation, all those things. So our experience, we have performed more than 6,000 bypass surgeries, 94% follow-up, 87% more than 15 years survival, 1% mortality. We are discharging patient at third day, 1 week recovery time. So we are moving towards a minimally invasive surgeries, robotic surgeries. Definitely it has a have faster recovery compared to the conventional surgeries. Thank you.
Thank you, Dr. Arun Kumar. We'll quickly move on to our next speaker, Dr.
Thank you.
Bharat Kumar ji, a senior consultant in interventional cardiology at Radial Road, Kauvery, Chennai. Dr. Bharat has more than 14 years experience in cardiology. He did his MBBS from Perandurai Medical College, Tamil Nadu, MD in General Medicine from Madurai Medical College, and DNB Cardiology from Southern Railways Hospital, Perambur. He has been a fellow of European Society of Cardiology and fellow Society for Coronary Angiography and Interventions. During the course of his career, Dr. Bharat Kumar has successfully performed various types of adult interventional cardiology procedures and is known to do procedures such as primary percutaneous coronary intervention in acute heart attacks, percutaneous transluminal coronary angioplasty, and stenting with excellent results. He has done more than 5,000 interventional cardiology procedures and has a remarkable academic record with many awards to his credit. He has peer reviewed publications in international journals and made several oral presentations at national and international conferences. He's an active member of the Indian Medical Association and the Cardiology Society of India. Dr. Bharat Kumar's presentation focuses on heart attacks among young adults. Welcome, Dr. Bharat.
Yeah. Good morning, one and all. The slides are visible, ma'am?
Yes, sir.
Yeah. Today I'm going to talk about the heart attack in young adults. As Dr. Arun already mentioned, usually this heart attack, usually a disease of old age, it commonly occurs in the very elderly population. But nowadays we are frequently encountering the heart attack in very young adults. We call it as young adults as age less than 50 years. So, what are the functions of the heart? As Dr. Arun already mentioned, it's a very soft muscular organ. It pumps at least 4 to 5 liters of blood every minute, and it is beating more than 1 lakh times per day. So, the main function of the heart is it pumps, it gives oxygen-rich blood to other vital organs in the body. And these are the coronary arteries, as Dr. Arun mentioned. These are present in the surface of the heart, and heart before giving blood to the other organs, it supplies itself. So there are various other forms of heart diseases. The most common being the coronary artery disease. So I am going into my talk will be pertaining to the coronary artery disease. So like similar to the age-related factors like graying of hair and cataract, these cholesterol plaques are formed inside the heart vessels over the age. That's why it is very common in the elderly population. But because of the altered lifestyle nowadays, it is very commonly occurring in the young adults. So the most important thing is we can see these are blood vessels which is present on the surface of the heart. Right side one is there and left side there are two vessels. See, this cholesterol plaque is here formed. One fine day what happens is this cholesterol plaque rupture occurred and it will clot, and the clot will form and it occluded the total vessel. Here we can see the clot occluded the vessel, and this we call it as heart attack. So these are the blocked arteries, and there is decreased blood supply to the one area of the heart. And in this area, there will be abnormal currents that can stimulate the abnormal arrhythmias. We call it as ventricular tachycardia or ventricular fibrillation, and it can lead into sudden cardiac arrest and death in acute heart attacks. In this juncture, I will commonly mention what is difference between this cardiac arrest and heart attack. Cardiac arrest is different actually, and heart attack is different. As I already mentioned, heart attack is when there is a disturbed blood flow to the heart because of blockages in the heart vessels. Whereas this cardiac arrest, it is because of abnormal electricity inside the heart. It can happen. It can happen, especially in the young adults and young athletes. This is very common. This commonly we can hear the news that while during exercise, some patient died immediately like that. So this is because of the inherent channel problems inside the heart. This is because of the electrical malfunction of the heart. Whereas in a heart attack, that it will give some time in the heart attack because the patient develops some pain as mentioned earlier. A patient will have a severe compressive type of chest pain associated with sweating, vomiting like that. And we have some thing called golden hour, which is between 60 to 90 minutes. Patients still have access to hospitals, and patient is usually conscious and associated with panicness like that. Then once the patient is reached the hospital, we can give loading dose, and then after doing this ECG and echo, we can do even we can open up the vessels, we can open the blocked vessels. Whereas in cardiac arrest, it is a very acute setting. It does not have any warning signs. Patient will suddenly collapse, and there will be no pulse, no breathing, and the patient will die immediately. So how can we? Those patients will be resuscitated only by CPR, or if there is even in people high gathering areas, we'll have AEDs, that is automated external defibrillator. We commonly found in airports, bus stands like that. So those which are available only, we can use this. We can prevent this cardiac arrest. So we have to differentiate between this cardiac arrest and heart attack. And heart attack is the most common for the sudden cardiac arrest. It's already mentioned. So heart attack we have some time, whereas the cardiac arrest there will not be any warning symptoms. It is more common with the inherent heart problems. Let's say some of the common cause for this sudden cardiac arrest include the abnormal channelopathies, that includes long QT syndrome or short QT syndrome, Brugada syndrome like that. So these patients without this cannot be identified by even X-rays or echoes or ECGs. So when these patients, when they do sternus X-rays, they may develop these abnormal heart rhythms like ventricular tachycardia and ventricular fibrillation, and this can lead into sudden heart attack. And there is a next common cause being the cardiac muscle problems, that includes hypertrophic cardiomyopathy or some other cardiomyopathies that can lead into these abnormal arrhythmias. And other causes are coronary artery anomalies, that includes coronary artery dissection, and then commotio cordis. This is also very, very important, especially the sports individuals. What is commotio cordis is when there's a sudden blunt injury to the chest, especially the steering wheel injury, or while playing because of baseball or hockey stick. When there is when there is heavy blow to the chest, the heart will suddenly stops. We call it as commotio cordis. This commonly occurs during some stampedes also. This is called commotio cordis. So these are the causes of this sudden cardiac arrest, and this is always fatal unless we can recognize it and someone knows CPR. This can be prevented. And this was already mentioned earlier. We very well know the modifiable and non-modifiable risk factors for this coronary artery disease, that includes diabetes, hypertension, dyslipidemia, smoking, and all. Now, what I commonly see is the risk factors for heart attack in the young adults being, we can remember as 5 years. The most important being the sedentary lifestyle. Nowadays, this is very common in the IT population, and also in the summer, and also in other young drivers also they are seeing this sedentary lifestyle where there is no physical activity. And then, as Dr. Arun already mentioned, this dietary factors plays an important role because of the increased consumption of the saturated fats, which can lead into higher risk for heart attack in the younger population. And another important thing is stress. Nowadays, people are encountering longer working hours, like they are working for almost 12 to 18 hours per day. That can lead into a heart attack in the young individuals. And indirectly, this stress lead into more substance abuse, that includes alcohol, weekend parties, and smoking, and other drug abuses is also very, very common, especially this cocaine. And another most important thing which I found that the risk factor for heart attack in the young adults is sleep. There is a disturbed sleep or sleeplessness. People are watching. The most important being the watching mobile during the night time. The screen time when we see the digital well-being, the screen time is much more prolonged, and it can lead into disturbed sleep. And some of the patients may have sleep apnea, especially the obese individuals. This is also very, very common, and it can also lead into heart attack in the young individuals. We can remember as 5 years. So how will you diagnose a heart attack? It is mainly diagnosed by clinical presentation and ECG, echo, and cardiac enzymes. We call it as troponin. Whereas in stable CAD patients, like who do not have heart attack, we can identify it by, as Dr. Arun already mentions, this stress exercise, that is a treadmill stress ECG, and then we can identify by CT calcium score and the CT coronary angiogram. So the most important thing is clinical, what we call it as angina. The angina is a very sharp compressing type of pain in the central. It is associated with the jaw pain. Sometimes it may radiate to the ears, especially this left shoulders and left arm, and is associated with sweating and palpitation and diaphoresis. Patient will classically say when there is acute heart attack, the patient will say the fear of impending doom will be there, and it will be the new onset of pain. The most important thing is the pain will be new in onset. The patient will never experience the pain before. It is a very unusual pain, and it is more severe in intensity. That is very important. And women are more likely to experience atypical presentation. Some patients will have some epigastric discomfort like that, and diabetic patients may not have experienced any symptoms. They have only slight chest discomfort because of autonomic neuropathy. They do not have pain. We call it as silent heart attack. Is very common in the diabetic population. So in this juncture, the most important thing is how to differentiate between this gastric pain and heart attack. This is very common because people with heart attacks, I have seen they self-medicate with antacids and this pantoprazole, and then they present us in a very late and bad shape. So how to differentiate between this heartburn and heart attack? The most important thing is heart attack pain. It is very heavy, and it's a new onset pain which you have never experienced before, and it is patient will have fear of impending doom. It is like elephant stamping on your chest. That much amount of severity will be there when you are having an acute heart attack. Whereas heartburn pain, it is a bearable pain. It is sharp stinging pain or burning pain like that. Usually, heart attack pain it worsens with exercise and stress, as I already mentioned. The pain is radiated to the arms, jaw, and back, and the left shoulder and left inner arm. And usually, the symptoms last for 15 to 20 minutes, and it will be a prolonged pain, and it is not relieved by antacids. And whereas the heartburn pain usually it is relieved by taking antacids, and it is related to the food. Most important thing is patient will have this bloating sensation, heartburns, and altered taste, and it does not spread to other part of the body. So in this way, we can differentiate this heartburn and heart attack. However, when you are having confusion whether I am having heartburn or heart attack, the most important thing is do not self-medicate yourself. Please go to the nearest medical center and take an ECG. That is the best way to prevent an heart attack, because we have seen many patients presenting to us with in a later stage, because we lost the golden hours. As I already mentioned, the golden hour is around 60 to 90 minutes. So it is very important. Do not self-medicate. Please go to the nearest hospital and take ECG. So how to prevent these heart diseases? We know that the most important preventive diet is diet, physical activity, and reduced stress. So we know everything about diet. We have to take a diet which is low in saturated fat, limit your salt and sodium, limit your alcoholic beverages, and choose a variety of whole grains, fruits, and vegetables, and choose fish, poultry, and lean meats. Avoid high-fat dairy products. So another important thing is exercise. We know that we have to exercise at least 30 to 45 minutes per day for at least 5 days a week. Begin today, make changes one step at a time. So if you are a smoker, quit your smoking. So for physical activity, what is the recommendation is moderate intensity exercise is recommended. We should not go to gym and do some workouts like that. Just simple walking is enough. Brisk walk is enough, or you can go for swimming, jogging, cycling like that. So we do not need any complicated machines or going to the gym. Just walking is enough. So these are the benefits of exercise. It improves your mental health and mood. It reduces your heart disease risk of heart disease. It controls your weight. It makes your blood pressure under control. It strengthens your bones and muscles. It makes your diabetes under control. And another most important thing in the young adults is smoking. We previously called smoking causes cancer, but most importantly, the smoking causes stroke and heart attack risk in a very young adults nowadays. And it can lead. It can also cause peripheral arterial disease, and it can lead to aortic aneurysm and other aortic disorders. So if you're a smoker, quit your smoking today itself, and it can improve if your quality of life, and also your you can live additional years certainly. And another important thing which you commonly see in the young adults is stress. And the most important thing is stress increases the heart attack risk by 1.34%, and increase the stroke risk by 1.75 times, and increase the blood pressure by 2.15 times. The most important thing is what are the techniques to reduce the stresses. We have to do exercise. We can practice meditation and yoga. We can do some relaxation exercise, take some breaks in between, go for recreations, and we can practice pranayama. We can take slow and deep rest. All these will reduce the stress. And if you're a diabetic, hypertension, or dyslipidemia, we have to do regular health checkups, and we can make control of all these diseases, and practice taking the medications as prescribed by your doctor. So the take home message is know your heart risk, and take a healthy diet, be physically active, walk at least 30 to 45 minutes per day, maintain an ideal body weight. If you're a smoker, quit smoking. And if you're at 30 plus age, and if there is any family history of heart diseases, do your health checkups. The health checkups are the only way to prevent this, to identify the silent diseases, and we can prevent the heart attack. So the prevention is this one. These are the common cause of this heart attack in the young adults. Do exercise, have a healthy diet, avoid stress, quit smoking, have adequate sleep, and do your regular health checkups. So take one step at a day. Replace your unhealthy habits with the healthier ones. Eat for a healthy heart. Start walking, and gradually you have to start. And we can reach. You can reach up to 2 hours and 30 minutes in each week as per the recommendations. So it's up to you to protect your heart health. Start today. So thank you.
Thank you, Dr. Bharat. As we move on to our last panelist, I would request all those who have joined to send your questions in the Q&A box, and the doctors will answer them after the presentation by a third speaker, Dr. S.P. Vinod Kumar, consultant in pediatric cardiology at Kauvery, Trichy. He did his MBBS from Government Medical College, Tuticorin, MD in Pediatrics from Government Medical College, Kochi, and DM in Pediatric Cardiology from PG, Chandigarh. He has several papers published in medical journals and has made presentations in national and international conferences. His areas of expertise include fetal echo and cardiac intervention, neonatal, pediatric, and adult CHD, arrhythmia, cardiomyopathy, and heart failure management, pediatric endocardial pacemaker insertion, and percutaneous structural heart disease interventions. A member of Pediatric Cardiology Society of India, Indian Academy of Pediatricians, and National Neonatology Forum, Dr. Vinod Kumar will now discuss congenital heart disease. Welcome, Doctor.
Yeah. Am I audible?
Yes, sir.
Yeah. Thank you for the kind introduction, and happy well holiday one and all present here. Today, as my two colleagues has presented around adult perspective, I would like to emphasize on the pediatric or neonatal perspective of the heart development and the congenital heart disease. Why it is important? Because 10 out of 1,000 live birth babies has propensity to develop have congenital heart disease, in the sense small hole to and the development of one side of the heart itself can happen to any babies, 1 in 100 babies. So considering that to 2 lakhs of approximately 2 lakhs of babies born with congenital heart disease every year in India. In that, one-fourth are critical congenital heart disease. Critical congenital heart disease means without any intervention, either percutaneous keyhole procedure or surgical intervention, the baby won't survive beyond, can't see more than 1 year of their lifetime. But with the timely intervention, we can save them and they can lead their normal life beyond that if we timely address the issue. So, because it is potentially treatable and salvageable conditions. Over aspect of my presentation is up to development, function, abnormalities of heart disease, abnormalities in the heart, and what are the symptoms we can expect in the babies, and what are the basic and high-fi investigations required for the diagnosis and further management in outline. So coming to the development, as initially Dr. Arunkumar sir said, the baby has the baby when the baby develop in the mother's womb, it has a complex procedure for the formation. Initially, only 2 tubes will be there. Further, it will 2 tubes only will be there, and it started beating at around 22 days of life itself, 22 days of intrauterine life itself, and it takes multiple complex process from the 2 tubes to form the all chambers like this. We can see here. Okay. We can see here right means upper 2 chambers are called as atria, lower 2 chambers called as ventricle. This right-sided chambers will carry the oxygen low blood to the lungs. Further, it will return to the left-sided chambers with good oxygen level, and that will further go into the body circulation. That will further return when after supplying the oxygen to the right upper chamber, and this vicious cycle continues if it is normal. So and that's about the structure, and it has own its conduction and electrical activity as like current supply in your home. There should be some main box, it is in the right side of the chamber, and some will be the switchboard kind of thing. It will be in the middle of the heart, that should be connected promptly, and further through the wires it should supply to your whatever the fan or lights kind of thing. So that should supply through the nerves wires to the appropriate chambers to function, contract, pumping normally. So the heart rate, adult heart rate varies between 60 to 80, but the in newborn babies, it will be double or triple of us. So it will be varying around 100 to 180, and further it will reach our adult heart rate by around 6 to 12 years of age. So coming to the abnormalities wise, structural, functional, and rhythm we can classify as structural. As we discussed, upper 2 chambers are called as atria, and lower two chambers are called as ventricle. If any defects between the two upper chambers, it is called as atrial septal defect. In this septum, some defect will be there, so it is atrial septal defect. So likewise, lower chamber, it is called as VSD, ventricular septal defect. Any connection in the outflow tracts, the vessel, right side vessel is going to the lungs, two lungs, and left sided vessel is going to supply all over the body. That is called as aorta. Lung vessel is called as pulmonary artery. Any connection between this called as AP window or PDA. So the outflow tracts, as I said, the pulmonary artery can be stenosed. It is called as pulmonary valves. The door can be narrowed tangentially. It is called as pulmonary stenosis. Aortic valve can be stenosis. It is called as aortic stenosis. This arch vessel can be narrowed. It is called as coarctation of aorta. So door narrowing also can be there. And structural, because these are which I discussed are acyanotic. The baby won't be blue in color. Some conditions the baby will be blue in color. In few of that we can discuss here. These are normal healthy heart. We can see the right atrium, right ventricle to the pulmonary artery to the lungs. It is going the deoxygenated blood, blue in color here, quoted here. But what we can see is here the main artery, that left-sided vessel is this uh, rearranged towards the right side of the chambers. So right atrium, right ventricle supplying to the aorta to the whole body. The deoxygenated blood, oxygen-less blood circulating to the body itself, means outside the body, not going to the lungs. So the baby will be deeply blue immediately after birth. And the good blood is circulating into the lungs from the left atria, left sided ventricle, into the pulmonary artery. There it's circulation in the parallel circulation. So yet another common condition is TOF. We used to say tetralogy of Fallot. They have large hole in the lower chamber and a smallish pulmonary artery. So there will be reduced blood flow to the lungs to get the oxygenation. Further, the baby will be deep blue. And yet another condition is the good blood should be returned from the lung to the left side chambers. Instead of that, it might connect to the right side vessels or chambers. It is called as TAPVC. That is also a surgical emergency in a newborn baby. If surgery has been done, the baby can lead to the normal life. Coming to the next spectrum, depends upon the muscle and function of the heart. We can see the normal heart here. Means in general, heart function means the lower chamber function. So we can see compared to this, we can see the proportionately dilated lower chambers. This is called as dilated cardiomyopathy. The function will be the contracting function will be less, so the pumping capacity will be less. Though there will be failure signs, as discussed earlier in the by the previous presenter. And here we can see the muscle of the heart is hypertrophic, thickened. It's called as hypertrophic cardiomyopathy. It can be obstructive as well. And yet another thing is restrictive cardiomyopathy. I'm not going into detail. These are the muscle related problems can happen in heart. And coming to the symptoms, it may varies between from the age group wise. In newborn, most commonly they present with respiratory distress, means fast breathing. They need ventilator support or oxygen support. Sometimes, as discussed, cyanotic canal heart disease may have bluish discoloration. Cyanosis means bluish discoloration of lips, fingers, and peripheries. They will have central cyanosis. Central cyanosis means bluish discoloration of lips and mucosa, oral mucosa as well. So they will be deep blue in color. So they warrant immediate medical as well as the any interventional treatment requirements. And in infants means grown-up newborns, more than 1 month, less than 1 year. So their most common work is feeding and crying. So whenever the increased blood in acyanotic conjunctivitis, there will be increased blood to the lungs. So that will be lung will be congested. So whenever they are working, it's for our exercise, for us during exercise, we can when the lung issue is there or heart issue is there, we will get some amount of dyspnea, means breathing difficulty. Like that, wise baby might have feeding means breathing difficulty while feeding. So they will stop sucking for a while and they will start sucking and they will rest for some time. Then they will suck. They won't. Uh, they can't able to continuously suck at the breast. So they will interrupt. There will be interrupted feeding, and for it means this head circumference is more in newborn babies when compared to the whole body. So they will have forehead sweating. Instead of whole body sweating, their initial symptom might be the forehead sweating, succrous cycle, and inadequate weight gain. So newborns, they will be followed up every during vaccination with the weight gain. So there will be inadequate weight gain for the babies. Succrous cycle can be there, and forehead sweating will be there. These are the predominant symptoms in infants. Toddlers, once they start walking, running, so there will be effort intolerance, or they can't run compared to the peers. They will be always tired, or recurrent infection, chest infection can be there in case of asymptomatic, means lungs will be flooded, that kind of thing. Recurrent pneumonia with warrant admission can be there. So these are all the subtle symptoms. In grown-up children, same, they can't expect the rapport means efforts kind of peer groups, and also they might be very less weight also can be less, and recurrent infection can be there. And grown-up children can address the palpitations. Palpitation means one's own awareness of one's heartbeat, means when the tachycardia means disproportionate increase in heart rate. So they can feel that sensation also. Atypical chest pain also can be there in children. These are the typical symptoms usually can happen in children. Coming to the investigations, we'll see one by one. The uh, most sensitive and specific investigation in newborn to diagnose this congenital heart disease is pulse oximetry screening, because with our test we can detect any abnormal heart sounds and abnormal sounds. We call it as murmur or abnormal heart sounds S1, S2, like that we can say. In that, any abnormality we can detect with step, and with palpating the pulse we can feel any variation in the pulse also. So with that, around 60% only congenital heart disease we can detect. But incorporating the oximetry screening, we all know post-COVID scenario, everyone aware of the pulse oximeter. So with your finger probe, you will check the oxygen. If it is more than 95, that is normal. So for the newborn also, more than 95 is normal, but we have to check in the right upper limb and one of the lower limb, because which I showed one duct PDA that will determine the preductal and postductal. So all newborn babies Please ensure parents, your baby should have in the discharge summary two oxygen levels in the right upper limb and one of the lower limb. That should be more than 95%. That can ensure that babies reasonably safe without any critical congenital heart disease, because congenital heart disease, because in cyanotic congenital heart disease, I said the baby will be blue. Once the saturation level less than 85% only, the baby will be visibly blue. But we might tend to miss the 85 to 95% of saturation cyanotic congenital who has the saturation between the 85 to 95 by visible screening or clinical examination. But the pulse oximetry screening, when we incorporate, it has sensitivity of more than 95% to detect the congenital heart disease. That might be the crucial thing to diagnose this thing for a life-saving procedure in the newborn baby. So coming to the next investigation, X-ray, we can see the middle one has the, this is two lung fields, right side and left side, and heart should be in the middle, bit to the left. This is the normal position, and some amount of these are the whitish patches are vascular markings towards the lung. And in the left side of screen, we can see the heart is, major portion of the heart is towards the right. This is dextrocardia, and we can see that here the heart shadow mostly occupies the thorax. Thorax means the chest cavity. So this is cardiomegaly. So for your basic understanding only, I have put the basic X-rays. And this is the ECG. We saw two atrial, two ventricle in the previous images. Here this small bump is the atrial current activity, and this short waves are ventricular current activity. We can see the 1:1 activity and beautifully in this ECG. In the next ECG, we can see the rapid heart rate in this ECG. This is called as tachyarrhythmias. And in the next ECG, we can see the slow heart rate. And these are small bumps. This is the short bumps of ventricle, not in the 1:1 conduction. This is slow heart rate. We can say it's of a complete heart block. These also need to be addressed. Coming to the next investigation, echocardiogram. It is a basic, simple ultrasound examination, OPD procedure, painless, no radiation. So we can easily diagnose the congenital heart defects with echocardiogram. We can see this is the two upper chambers. This is ASD. The defect is that blood is coming from the left side of the atrium to the right atrium. Further, it will go into the lungs and flood the lungs. So this can be easily closed percutaneously. And this image, we can see the lower chamber of the two hearts, ventricle, right ventricle, left ventricle, and defect is the VSD. And here we can see the narrowed valve. This is a pulmonary valve. Usually the door should open freely, but it is very stiff and thick, not opening properly. There won't be adequate blood supply to the lungs, and oxygen level also can be less, so that to be opened up. And here we can see the two running image. This is the left side lower ventricle, lower chamber, left ventricle we would say, and that looks beautifully pumping. But here we can see it is hardly contracting. It is ventricular dysfunction. And yet another thing, as we said, muscle thing lesions, we can see the muscle is very thick when compared to the previous images. This is hypertrophic cardiomyopathy. And here we can see the mass lesion in the atria. This is upper chamber, mass lesion. It's a tumor mass in the heart of the infant. And coming to the how early we can detect the congenital heart disease, because nowadays the science is advanced and we could able to see any minor heart defects in the cherry-sized heart of the fetus. Fetus means the growing embryo, growing baby in the mother. It's called as fetus. So during 18 to 20 weeks, when we do a special scan, that is also ultrasound, basic ultrasound scan, painless, no harm, no radiation. We can see the beautiful four-chamber images here and the vessels, and this also arch beautifully we can image. Not only the structures, the rhythm also we can beautifully evaluate in the in utero, it's fetal life itself with the fetal
Dr.
echo
Vinod
scan.
Kumar, we have
Yeah, I'm
overshot our
winding up.
program
I'm
time. If
winding
you
up
could rush through.
in a
Yeah.
couple of minutes. Come to the management, medical drugs also we can use for stabilization. Percutaneous keyhole procedures like device closures like this for ASD and PDA, we can percutaneously close, and stenting in an emergency procedure to save the life of the newborn baby. And this is a critical stenosis can be ballooned up easily. And this slide shows a life-saving procedure in a uh, 1 kg baby that close the PDA, pinnet size device appropriately placed in the duct to prevent the high blood flow to the lungs. So And surgery also evolved a lot. Complete corrective surgery, minimally invasive surgery, and palliative surgery. In case of very complex congenital heart disease, we can do a palliative surgery as well to prolong their life. And most of the time, the congenital heart defect is completely correctable. They can lead their life normally. So we should avoid stigma that the baby is having something worry something. They won't lead their life. So whether it is worth it to spend or worth it to treat the baby at socially as well as the school stigma also is there, so that we should avoid definitely. So the thing is early diagnosis and timely treatment will lead to their normal life. So we should start supporting the children and family with congenital heart disease. Thank you.
Thank you, Dr. Vinod Kumar. We'll quickly move on to the questions. We'll take a couple of them. Purushottam Venkatraman is asking, what could be the reason for high incidence of cardiac events in present younger generation? Is it kind of due to stress? Is it due to diet? Or is it due to lack of exercise or even over exercise? And I'm clubbing another question. What are the preventive medical tests which can be taken for the young gym goers, who are all into protein shakes and are maybe doing more exercises? So who would like to answer, Dr. Bharat Kumar?
Yes. Yeah, as already mentioned in the slide, the most common causes the younger generation is because of physical inactivity, this altered dietary pattern, stress, the substance abuse is very, very important. So all this club together will, and the more important thing is sleep. Sleeplessness is very, very important, or disturbed sleep. All this is clubbed together will lead into cause increased risk of heart attack in the younger generation. Related to gym goers, if you are a professional, what I suggest is you have to go for regular health checkups like ECG, echo. Then only we have to go for gym, like a bodybuilding exercise, or if you are a professional like that. Other than that, for normal individuals, unless you are doing actually what is recommended is we can do moderate intensity exercise. Like we can do cardio exercise more than compared to weightlifting. But if you are planning for bodybuilding, certainly you should undergo ECG or echo or contact a nearby cardiologist to assess your heart health condition. And another important thing for all gym goers is don't stretch beyond your limits. If you are having undue symptoms like sweating, palpitation, or chest pain, or unusual chest discomfort while doing exercise, don't push beyond your limits. Please, if you are having experiences these symptoms, please contact your nearest doctor.
For the senior citizens, what would be the best practice to keep a heart healthy?
This everything is same only. We have to follow up exercise, diet, avoid stress, and have adequate sleep. Especially elderly patients will have multiple risk factors like diabetes, hypertension, and cholesterol. So these HbA1c levels should be, we have to keep it under control, and BP should maintain less than 140/90. You have to maintain the adequate body weight, and these are all the simple things which we can avoid these heart diseases, especially in the elderly population, heart attacks.
Dr. Arun Kumar, maybe you could take this. Indu Nambi is asking, cardiac disease symptoms in women are not typical. So what are the signs to look for in women?
In a women, usually the heart disease protected by their hormone called estrogen. But still, this is not 100% protection. So still the female in a younger age, we operated 29, 30 as a female with feeding mother, all those things. So we don't, everyone used to think we are female and we don't have a diabetes, we don't have a sugar, hypertension, all those things. But the basic thing, this coronary artery disease, heart problems not caused by a single factor. Like a dengue caused by dengue virus, but it is not same in a coronary artery. It's a multifactorial. So stress, poor lifestyle, poor eating, high calorie diet, and poor sleep. These are all contributing for even the females. Even in breastfeeding female who is under tremendous stress develop coronary heart disease, we operated. So these are all the things you have to take care. You have to balance the life. Even if you are not diabetic hypertension, you have to balance the life, adequate sleep, adequate concentration over the food intake, and proper checking at least once in a 5 years. And these are all the things can give a real insight about our own health, like looking at the cholesterol level, looking at the hyper pressure level, all those things. So females, really it's a most important yeah, family member who takes care of the family. They have to look after them also. That is a very important point.
In your presentations, you all talked about heart attacks and sudden cardiac arrest. So Chayan Das wants to know what is cardiac failure and how does one
Right.
prevent that?
Sudden cardiac death. That means sudden heart cessation of the heart function. Heart is a motor basically. Heart is pumping the blood. This is all sudden stopping of the blood. Sudden stopping of the heart function is called sudden cardiac death. Then heart failure. That means the heart able to pump the blood in a 70%. When the blood is coming into the 100 ml into the heart, it able to pump 70 ml. That is normal. When the heart is not able to pump the 70 ml, that means heart failure. The poor heart function, that heart starts dilating. So the patient feels breathlessness, the edema in the leg, the edema in the face, and abdominal distension. Even they feel the discomfort on lying down and sitting, all those things. These are the classical symptoms of heart failure. These symptoms requires immediate attention, requires treatment from the experts. So these are all the signs. It may be arising from the heart. It may come from the liver, all those things also. But very common area, the heart failure, the reason is coronary artery disease.
Shankaran Yuvarajan is asking, to what extent is our mental well-being related to heartbeat rate? Maybe Dr. Vinod Kumar, would you take that? Mental well-being and heartbeat.
Yeah, definitely, because now it's of cardiac and brain is interconnected. We have a heart brain clinic itself because one's own heart health remains, means brain health also remains in close relationship with the heart. So whenever we are disturbed, we know we have a sensation of our own heart, increased heart rate also. So that will affect the further sleep or further circadian rhythm, we would say. That will maintain our normal hormone balance. That also will get into imbalance. So whenever we extend that circumstances, we have to encourage our mental peace or mental health also equally important to maintain the heart health.
Right. We are really short of time, so I would like each of you to wind up with just, if this is again Sumati and Hema Kumar are asking, if you could give each of you one golden rule for heart health in 2025, what would it be? Since we are having this discussion on World Heart Day, each of you, if you could just cite one golden rule for heart health.
A perfect balanced life. So you should able to balance your work and your life. So you should take care of your life. You should at least know about what is going on inside your heart, inside your body. That is a golden rule. Many people not aware of their own health, sleepless nights, stressful life, poor habits. They eat midnight biryanis and midnight food. These are all are spoiling their life and they are causing a lot of family burden. So balance your life. You should know how to balance. That's it.
Dr. Bharat?
Yes, ma'am. Actually, what is my suggestion is nowadays people are using this social media and screen time is increased quite a lot. That indirectly leads to physical inactivity. The most important thing is my advice would be improve your physical activity and eat hot healthy diet and limit your screen time. And as Dr. Arun mentioned, the work-life balance is also very very important. Avoid stress and follow healthy habits.
Dr. Vinod? Dr. Vinod, would you like to go? Well, I don't see him on the screen, and we are really, there's due to lack of time, I'm not able to take the questions. There are many more, and there are also very specific questions where people have talked about their particular ailments. If the doctors wish, you could answer them directly. And I would like to thank all the doctors for joining us on World Heart Day and telling our audience how to keep the heart going. The World Heart Day 2025 theme is Don't Miss a Beat, a message that encourages regular checkups, monitor for warning signs, and maintain a heart healthy lifestyle. As we all understand, the heart is our most powerful organ, so as long as it beats, there is hope. Thank you, audience, for sending in your questions, and I hope all of you have enough takeaway points from today's webinar presented by Kauvery Hospital under the Hindu Wellness Series. Thank you.